Welcome, everyone, to our episode 77 of our podcast, Cultivating a New Generation. In today's episode, we are going to discuss a topic that is very controversial in terms of medical doctors prescribing a lot of drugs that contain glucocorticoids, which are very, very harmful for many of our body functions. And people don't know, and they just consume them in higher periods of time and quantities, in longer periods of time and higher quantities. And that's what makes the effect of them very, very permissive for their metabolic functions and for many other functions that we are going to review in this episode. So stay until the end because I'm going to explain also how they work in terms of your metabolism with a diagram and also how they affect your brain. So the title of the episode is What are the effects of glucocorticoids in your body? And the reference that I use is from the author Alan I, and is from 2017, and the title of the book is Side Effects of Glucocorticoids, Pharmacokinetics and Adverse Effects of Drugs, Mechanisms and Risk Factors. So let's go for the topic and let's start defining what are the glucocorticoids. Glucocorticoids represent the most important and frequently used class of drugs in the management of many inflammatory and immunologic conditions. Besides these beneficial effects that sometimes they claim, glucocorticoids are also associated with serious side effects, which is what matters in this kind of episode. The Cushing syndrome, adrenal suppression, hyperglycemia, dyslipidemia, cardiovascular disease, osteoporosis, psychiatric disturbances, and immunosuppression are among the most important side effects of systemic glucocorticoids. So as you can see, the list is very long and very dangerous effects. All of these side effects are especially noticeable at high doses for prolonged periods, which is what I mentioned at the beginning. People don't know sometimes how to identify the name of these kind of compounds, and they just consume what the doctor says. The problem is that many of the so-called trivial treatments for probably just getting your nose regular and not constipated, for treating certain kind of diseases of the skin, for your eyes, if you have conjunctivitis, or just sometimes red eye, many doctors prescribe these glucocorticoids in certain forms, and people just use these kind of drops or ointments as if they were not harmful. That's the whole problem of the exposure time. The term glucocorticoids represents both naturally secreted hormones by adrenal cortex and anti-inflammatory and immunosuppressive agents. Since the successful use of hydrocortisone, which is also known as cortisol, the principal glucocorticoid of the human adrenal cortex, in the suppression of the clinical manifestation of rheumatoid arthritis. Many synthetic compounds with glucocorticoid activity have been manufactured and tested since they discovered the effects of this kind of hormone. So the differences between pharmacologic effects of synthetic glucocorticoids result from structural variations of their basic steroid nucleus and its side groups. As you could hear, steroid is the nucleus of these kind of compounds, which is also the nucleus of many of your hormones. And partly the effect that they have dysregulating your metabolic functions has to do with this kind of resemblance. These structural variations may affect the bioavailability of synthetic glucocorticoids. These include gastrointestinal or parental absorption, plasma, half-life, and metabolism in the liver, fat, or target tissues, and their abilities to interact with the glucocorticoid receptor and to modulate the transcription of glucocorticoid responsive genes. Approximately 90% of endogenous cortisol in serum is bound to proteins, primarily corticosteroid binding globulin, which is abbreviated as CBG, and albumin. Conversely, synthetic glucocorticoids other than prednisolone either bind weakly to albumin or circulate as free steroids. Because they have little or no affinity for CBG, the free form of these glucocorticoids, which I am going just to mention now as GCs, they can easily diffuse through the membrane and can bind with high affinity to intracytoplasmic glucocorticoid receptors. So they are blocking the receptors for our own produced glucocorticoids. Glucocorticoids perform most of their effects owing to specific immanent distributed intracellular receptors. Binding of these GCs to this receptor creates a complex which can translocate into the nucleus, where it can interact directly with specific DNA sequences, which are called glucocorticoid responsive elements or GREs. So that's the main issue in terms of affecting the sequence of your genes and also down-regulating the production of many transcription factors and proteins that are very important for other metabolic health functions. GCs are metabolized in the liver. Also, your liver is also having a lot of work by processing these kind of synthetic drugs. The kidney excretes 95% of the conjugated metabolites, and the remainder is lost in the gut. Exogenous GCs have the same metabolic processes as endogenous GCs. The half-lives of synthetic GCs are generally longer than that of cortisol, which is approximately 80 minutes. So that's a problem also, that the half-life of many of these kind of drugs are also higher or longer in terms of the minutes that they are going to stay in your body. So if you keep abusing the dosage that the doctor recommended, which many people do, and they don't abide to the instructions many times, the problem is that you are overloading your system with this kind of GCs. And even if you sometimes respect what the doctor says, many doctors don't research more about the dangers of the side effects of these kind of compounds. So glucocorticoids that are most common are also, I'm going to mention some of the names. Some of them are cortisol, as I mentioned, cortisone. This is another cousin of this molecule. And cortisone, what we can find it in many products of skin lotions or ointments, even some eye drops, and sometimes medications to treat intestinal problems. They have a plasma half-life of 80 to 120 minutes. So that's 40 minutes more than the endogenous cortisol. And the biologic life, that's the worst, is from 8 hours to 12 hours. That's why if they are prescribed, you should just have them in the morning and at night, and that's it, and not for a prolonged period of time. What are some intermediate acting glucocorticoids that are also very common? Prednisone is one of them, and the half-life of this compound is 60 minutes, but the biological life, which is the time that it stays in your body and it's circulating still and causing side effects, is 18 from 18 to 36 hours in biological life. Another one of another spectrum, which is long-acting, is Dexa Metazone. That's also very common in many products, as I mentioned, and the half-life of this product, of this drug, is 200 minutes. That's the half-life. And look at this, or listen to this. 36 to 54 hours of biological life. That is more than 2 days in your body that these kind of compounds stay inside and circulating and producing effects. That's the importance of knowing what we are consuming in this kind of pharmaceutical drugs. GCs are used in nearly all medical specialties for systemic therapies. GCs represents the standard therapy for reducing inflammation and immune activation in asthma, as well in allergic, rheumatoid, collagen, vascular, hematological, neurological disorders. All of those classes of problems that you are manifested, which can be repaired just by asking the patient more questions about what they are consuming, the lifestyle, etc. They are being treated with these kind of drugs. And these kind of drugs stay in your body almost, some of them, almost 2.5 days. That's a lot of time in your body and causing a lot of troubles. Also, these GCs are used in renal, intestinal, liver, eye, and skin diseases, and in the suppression of host versus graft reactions. So when you have a surgery and you need to have either some skin or some organ is being replaced, they are also used, but well, in those cases, they are necessary because your immune system has to be down-regulated in order to accept the transplant. So these synthetic glucocorticoids administered as replacement therapy in primary or secondary adrenal insufficiency and as adrenal suppression therapy in glucocorticoid resistance and congenital adrenal hyperplasia. So you have a problem with your adrenal system, which is the one that is in charge of producing cortisol. And they give you competitors of this cortisol. It doesn't even make sense. Or you already have glucocorticoid resistance, and they prescribe you another glucocorticoid that is going to create a second resistance to the compound. So what are they doing? They are not even thinking about what they are doing or researching what is happening and how this affects your body. GCs affect many, if not all, the cells and tissues of the human body, those awakening a wide variety of changes that involve several cell types concurrently. So that's the problem. They affect almost, cells and tissues. Gene transcription. What is happening in the gene transcription area? Binding of the receptor to the GRE sequence may cause either enhancement or suppression of transcription responsive downstream genes. GCs inhibit the synthesis of almost all known inflammatory cytokines. That means that you are not performing a well prepared or well equipped immune response to any kind of disease, any kind of virus, bacteria, or whatever it attacks your body. You don't have an inflammatory response because you are using this kind of drug. So that's the problem. Your immune system is being depressed. What are the post-translational events and what does this mean? This means once these compounds bind to the sequence of your genes and they suppress the release of many of these immune messengers, what they are going to do is that they are also going to inhibit secretion and synthesis of inflammatory molecules. So they are depressing even more your immunity. And the inflammatory molecules that they suppress, they are interleukins. And these are extremely important to assemble a very, very powerful immune response against anything that threatens your body. So the ones that are being suppressed are IL-1, which is interleukin 1, IL-2, IL-6, IL-8, tumor necrosis factor, inflammatory eicosanoids, and cyclooxygenase 2. Those two, at the end, serve the function of also repairing wounds and in the cicatrization process. So you are not even being able to repair your own wounds when you are under the treatment of these kind of substances. And they affect the post-translational events, so the post-production of these kind of proteins. What is the effect on the distribution of blood cells? Because they also affect your blood cells. The administration of glucocorticoids predictably results in neutrophilic leukocytosis, dramatic reduction in circulating eosinophils and basophils, transient minor reduction in monocytes and total lymphocytes. Acute lymphopenia normalizes by 24 or 48 hours, depending on how much time you have been under these kind of treatments. GCs have no direct effect on erythrocyte and platelet count that they know right now of, but in the future we might discover that they also affect these kind of cells. But anemia and thrombocytosis can heal with improvement of chronic inflammation. So they are also causing or they are associated with problems of anemia and thrombocytosis. So just to give you a hint of what are they doing in your system. The side effects of systemic glucocorticoids, what are they? The toxicity of these GCs is one of the most common causes of iatrogenic illnesses associated with chronic inflammatory disorders. The side effects of these GCs have been known for decades, but the exact risk-benefit ratio is incomplete and inconsistent because it is difficult to differentiate the effects of GCs from the effects of underlying accompanying diseases and other comorbidities or with other medications, the interactions. So what is the problem in the treatment with these kind of substances? They prescribe you this, but this is not just the only prescription that they give you. You already have another drugs that you are consuming. So these mask the effect of these kind of compounds. And if you also have other comorbidities such as diabetes, hypertension, or any of these, they are going to enhance the disease. They are going to promote the disease to advance further. GCs are associated with side effects are dependent on both the average dose and the duration of therapy. Overall, it can be stated that prolonged application is a high risk factor. So I'm going to repeat that so that you pay attention. Overall, it can be stated that prolonged application is high risk factor, whereas total dose is of secondary importance, although you have to pay attention to the total dose. Even in low-dose therapies, GCs could lead to serious side effects. That's also very important. Even low dose can cause side effects. The severity ranges from cosmetic aspect, such as telangiectasia or hypertrichosis. Telangiectasia are veins that are similar to the shape of an spider. And hypertrichosis means excess of hair body in women also. Single or multiple side effects can occur. The side effects of these GCs are the major limiting factor for the use of this agent. Limiting factor for the use, but many doctors prescribe them as if they were just candies. An overview of the most common serious side effects of GCs. I will tell you the summary of those kind of serious side effects. Adrenal insufficiency is one of them. The most common cause of the chronic administration of these high doses of GCs is adrenal insufficiency. And this is called iatrogenic because it was caused by the problem of abusing these kind of systems. They also cause a significant suppression in the HPA axis or hypothalamic pituitary adrenal axis. This HPA axis in small doses and for only few days, they are causing significant suppression. And they cause the adrenal cortex loses the ability to produce cortisol, which is one of the major hormones to regulate many other secondary, tertiary, and messengers in your metabolic functions, in plenty of them, if not all of them. In the absence of this adrenocorticotropic hormone, or ACTH, that's the problem that they are causing. When the suppression of these ACTH levels prolongs, this situation causes atrophy of the adrenal cortex and secondary adrenal insufficiency. That's why also people are extremely tired still, because many of these drugs were also used to treat COVID symptoms. That's also the problem. Steroid withdrawal or adrenal insufficiency. These GCs are also tapered with effects that they decline, and patients might experience lethargy, myalgias, nausea, vomiting, and postural hypotension. So when they take you out from this therapy, all of these symptoms you can have: lethargy, myalgias, nausea, vomiting, and postural hypotension. In this situation, increasing the dose of GCs to prevent this adrenal insufficiency may delay the recovery of the adrenal function. So the problem is that many doctors, when they prescribe this and then the patient comes back and has these kind of symptoms, what they do is give you another kind of glucocorticoid in a lower dose for a shorter time, but they are creating the resistance that we spoke earlier. So you are caught, trapped in a loop of disease. That's the very dangerous problem. Maximal caution is advised with any kind of these withdrawal symptoms. Fortunately, the adrenal cortex repairs the ability to secrete sufficient amounts of cortisol for some period of time. So even if you experience these kind of symptoms, what your body is doing is trying to detoxify and regulate again to give you the production of cortisol. So stop using these kind of medications because they are very, very dangerous. Repair of endogenous cortisol secretion is expected after stopping the exogenous disease, but the recovery time may vary in certain patients. So just be patient, and that's it. What are other side effects? Emotional lability, enhanced appetite, weight gain, or both. Insomnia, glucocorticoid-related acne, diabetes mellitus, hypertension, peptic ulcer disease, Cushingoid appearance or Cushingoid appearance. This is the Cushing syndrome, and the Cushing syndrome is a rounded face and a certain, well, I don't know exactly the term, but it's a bump here in your neck of fat tissue, and you are also gaining a lot of weight. Hypothalamic pituitary adrenal suppression, the HPA axis suppression, impaired wound healing, as I mentioned before, myopathy, osteonecrosis, so your bones are being destroyed, increased susceptibility to infections, as I mentioned. And other ones that are probably going to appear if you prolong the time that you are consuming these products. Atherosclerosis, cataracts, fatty liver, growth retardation, osteoporosis, skin atrophy. And the rare ones, glaucoma, pancreatitis, pseudotumor in your brain, and psychosis. Just that. If you wanted more, I think this is just amazing. How can they just prescribe them for as a first line of treatment? They don't even know what they are doing. So in terms of the adrenal suppression, what is happening when you have this adrenal suppression that can be caused as a result of the exposure to these kind of glucocorticoids? Weakness and fatigue, malaise, nausea, vomiting, diarrhea, abdominal pain, headache, fever, anorexia or weight loss, myalgia, arthralgia, psychiatric symptoms, poor linear growth in children, poor weight gain in children, and clinical signs of Cushing syndrome. And what happens if you have an adrenal crisis? Well, you have hypotension, decreased consciousness, lethargy, unexplained hypoglycemia, hyponatremia, seizure, and probably coma. All of those effects they have. Weight gain and lipodystrophy. These diseases also are going to completely disrupt the balance of the lipid system and the metabolism of lipids. So diseases have reciprocal effects on adipose tissue metabolism, promoting both lipolysis and lipogenesis or adipogenesis, inducing irregularity of adipose tissue distribution. That's the lipodystrophy. About 60 to 70% of patients treated with disease for a long-term period report weight gain. So that's one of the problems. The risk of weight gain increases from the use of 5 to 7.5 milligrams per day of prednisone or an equivalent. The risk of these side effects are higher in younger patients, females, those with a higher baseline body mass index, and those with a higher initial caloric intake. So they are also going to disrupt the leptin and the resistin levels, which are two extremely important hormones in terms of your satiety signals and the way your body is regulating your energy. And finally, cognitive effects. So they affect your brain and your learning process. Cognitive impairment is a common symptom, dose-dependent side effect of this disease. Deficit in attention, concentration, memory retention, mental speed, and efficiency. All of those symptoms are due to the use of these kind of drugs. Prolonged exposure to moderate and high doses of disease may cause cumulative and long-lasting effects. Cumulative means building up. They are expanding the symptoms and long-lasting effects on specific brain areas. Low doses of disease do not affect adult cognitive functions in both short and long-term exposure. That's what they say, but after reviewing all of this information, I don't think I can believe that. Older patients appear to be more sensitive to memory impairment with short-term exposure. So all of those are some of the effects that you can have while using these kind of medications. So it's extremely important that you pay attention to what are you doing in your body and what are you consuming. And if they are just prescribed because the doctor doesn't even want to make an effort to properly have an interview with you. So that's the kind of problem that we are going to be faced with when we are abusing these kind of treatments. So just pay attention to these kind of effects, because it is extremely important that you know that you are really, really damaging your body in terms of not paying attention to the kind of effects that you can have. So now I'm going to present the mechanism of action from these kind of substances. So what is going to happen now in your body? Let's see what happens. As you can see here, the effects of this glucocorticoid system, it's going to expose a lot of adipose tissue and hepatic acid metabolism functions. So what is going to happen here? Adipose tissue, lipoprotein lipase, HSL, and ATGL, which are two of the messengers of these kind of metabolic signals, so that your body starts uptaking the lipids and processing them in terms of giving you energy. They are not going to be working well. The expression is increased, so they are dysregulated. Responsiveness to growth hormone and catecholamine actions, dysregulated also. Lipolysis increase. Lipolysis is the use of the lipids, but not the ones that you would like to start using. Adipogenesis activity increase the visceral fat. So you are storing visceral fat, which is the one that surrounds the organs and makes more difficult for you and for the organs to work properly. And you are also having AMPK activity inhibited, which is also increasing visceral fat. So it's extremely, extremely important that you pay attention to this, because these two are two mechanisms that are very toxic in terms of damaging your organs. They also affect and they increase the release of free fatty acids in important circulation, and that's what also messes up the system of metabolism of the lipids. In the liver, they create insulin resistance, alteration of insulin signaling, gluconeogenesis increase, which is a process. Gluconeogenesis, I explained it 2 episodes before in the one of irisin. And gluconeogenesis is the production of glucose by glycogen. When you are degrading glycogen from your liver and from the muscles, you are releasing some of glucose molecules because you seem to need more glucose in your system. This is not the case. This is a dysregulation of the system. So you are increasing the glucose in your blood, which is going to be leading you to develop diabetes. Triacyl glycerides storage, so these are going to increase, and VLDL secretion increase. These two are markers for cardiovascular disease, and they are going to clog your arteries, and the blood is not going to be able to be pumped in the correct way. So oxygenation is going to be also altered, and the nutrient disposition in all your cells is going to also be affected. De novo lipogenesis increase, free fatty acid oxidation is inhibited, AMPK activity is increased. This AMP is a cousin of the ATP, but this is a messenger that works in many of the metabolic energetic processes. So if it is increased, the activity, the processes of your metabolism are not going to be adjusted and synchronic. Hepatic steatosis, this is fatty liver acid. Fatty liver. Fatty liver in the surroundings of your liver are going to increase the damage of your liver. And what happens in terms of the sequences? Glucocorticoids, as I mentioned, they are going to bind to the glucocorticoid receptor, and these GRE systems or elements, they are going to bind to certain sequences of your genes, and they are going to also bind to receptors for steroid hormones, thyroid hormones, vitamin D, and retinoic acid. So if you have a deficiency of vitamin D, which is one of the most important vitamins in terms of the calcium absorption and also protecting you against viral diseases, this is why, because these glucocorticoids bind to also many of these receptors. If you have an imbalance of your hormones, this is the reason, because these glucocorticoids bind to the receptors of steroid hormones, which include many of your hormones. Thyroid hormones also, hypothyroidism or hyperthyroidism are going to be or can be secondary causes of the use of these products also. So when they bind to these kind of sequences of your DNA, what are they going to do? They are going to decrease or increase the accumulation of mRNA within the target cell, of certain kind of very important proteins in terms of your immunity. They are going to decrease or increase transcription of genes coding for specific proteins of your immune system, and they are going to change the rate of synthesis of specific proteins that carry out the biologic action of hormones. So they are going to disrupt your whole hormonal system. What do they do in the brain? This is really, really important. Glucocorticoids in the brain, they cause appetite stimulation, so you don't have satiety signals, and you can keep eating. Preference for calorie-dense food, so this is processed food. That's why you are being primed, because you are also consuming these kind of products, the glucocorticoids. They are going to have in central fat adipogenesis, so they increase the fat in the central area, which is the most toxic fat. Differentiation of the adipocytes, as we mentioned, and hypertrophy. So hypertrophy means that this kind of lipid accumulation, it's going to lead to many problems, as we depicted here, of the accumulation of these VLD and TACs. Now, peripheral fat, they increase lipolysis, not in a good way, because you are just processing many lipids that are in the periphery, but the ones that are being stored and the ones that are causing the increase of the toxic lipoproteins, they are not going to be affected by that. They are going to this decrease the activity of the LPL, which is a very important hormone that is going to signal the real metabolism to produce energy from the lipid consumption. And they are going to decrease the brown adipose tissue. If you remember in the episode of irisin, I mentioned that the brown adipose tissue is the best one because it has a lot of mitochondria. And that adipose brown tissue is the one that is going to be used to produce the energy that you require during your days. And they are going to have also effects in thermogenesis and UCP1 expression. This UCP1 protein is involved in the metabolism of fatty acids to produce energy. So you are not going to use your fat for energy. You are just going to store it in the worst ways. And this is going to cause adipose tissue expansion and redistribution, but it is all disrupted. So all of those are the effects of these glucocorticoids, just so that you are informed and just so that you question more your doctor when they prescribe you this kind of medication, and so that you also read many of the cosmetic or eye drops or any kind of drug that you are going to consume. Read it and look for the names. And if you find that one of them, the active substances, is a glucocorticoid, be careful with that kind of prescription. Thank you very much for paying attention. If you like the episode, if you like the message, if this was very informative for you and you can help people to wake up and not consume an excess of this kind of products, just help me to share the video, share some questions, and give me some reactions so that the video can keep moving and being also consumed by more people. Thank you. Have a wonderful day, and we will listen to each other on our next episode. And subscribe to the channel, please. Thank you. Bye.